Must watch for anyone who has developed wrinkles, whose facial contours have started to sag, who has jowls, cheeks, or drooping eyelids. And overall, if your face looks tired. Most importantly, if you want to change that, we're going to talk about ptosis and the deformational type of aging. I'll tell you about some not-so-obvious things that cause the face to start sagging and looking tired. I'll also show you exercises that can help fix this problem. Before we get started, please subscribe to my channel. And please give this video a like, because it helps my videos get promoted on YouTube so that as many people as possible can see them. Friends, ptosis is a process in which the tissues lose their elasticity and the face gradually sags downward. And this isn't just about age, getting older, the environment, or gravity, because gravity affects everyone the same way. At 50 or 60 years old, two people can look completely different from each other. The first cause of ptosis is excess weight. That is, when the fat tissue in the face increases, under the influence of gravity, it stretches the skin. And be careful. If you decide to lose weight quickly, it can make things worse, because the skin and connective tissue don't have time to adapt to rapid weight loss. You have subcutaneous fat. There will be less fat tissue, but the sagging skin will remain. That's why, if you do lose weight, you need to do it slowly. If you look at people from a young age to old age, what can you see? You can see that with age, the spine starts to shorten, literally to shrink. A spring that gets compressed. The more it compresses, the more tension builds up in the body, and the shorter the neck becomes. That's what I see in everyone. Those with a short neck have sagging faces. Pay attention to your posture. If your neck gets much shorter, you'll notice sagging. Friends, I'm curious. Do you actually believe that at 50 or 60 years old, you can completely get rid of facial sagging or not? Please let me know in the comments. The next not-so-obvious cause of ptosis is tension in the skull. You usually hear that there is muscle tension, but few people mention that tension and tightness can also occur in ligaments, blood vessels, organs, and even the bones of the skull. As we age, nerve conductivity decreases, and nerve conductivity is responsible for metabolism and tissue nourishment. Compression, it further reduces nerve conductivity, and that's why fluid retention will occur in the face. The face will become more swollen, the skin becomes more flabby. And the next not-so-obvious reason, which I think will surprise many, is the tension that is transmitted through the ligaments and the musculofascial system from the internal organs. All these organs are interconnected. If there is tension in the intestines, that tension can be transmitted from the intestines to the liver and stomach, to the heart, the thyroid gland, the organs of the neck, and further on to the face. That's why the tensions coming from the internal organs play a key role in the development of facial deformation. Moreover, I'll show you a simple example. Look, let's say there's a spasm somewhere in the intestines, in the abdomen. You touch your stomach. It's bloated, tense, and there are some tender spots. This knot of tension, this spasm, leads to the fact that it creates tension in the tissue, and the body literally starts to twist in this direction. You see, the shoulders start to turn inward. The chest begins to cave in. The stomach might even stick out. The neck starts to shorten, and this leads to a tucked chin. But in reality, the cause is over there. By the age of 50 or 60, when a person has problems with their gallbladder, issues with their intestines, and so on, all of this leads to severe tension in our body, which deforms the face. It's not just by chance, but because it's a certain biomechanics of aging that happens both in the face and throughout the whole body. This is exactly what I talk about in my rejuvenation course. In order to restore the beauty and youthfulness of your face and look 5 years younger. If you want to look young, join my program. The link is in the description. And the next important reason for facial deformation and the appearance of jowls is swelling. For everyone who suffers from swelling, the deformation process accelerates many times over. I think even 10 times faster. Because when fluid accumulates in the subcutaneous tissue, it increases the volume of the tissues. And since the skin is thin, it just starts to stretch. If, for example, you've had lymphatic drainage or restored your body's water balance, the skin still remains stretched and deformed. It's very important to make sure there's no swelling on your face. Do lymphatic drainage exercises and gymnastics every day. In most cases, from what I've seen, you can even restore the facial contour 100%. And as I promised, I'll now show you an exercise that will help you get rid of these tensions and tighten the facial outline. A lot of muscles attach to these areas, which are connected to the neck and even the chest. You grab the corners of your mouth, and then, one by one, start pulling them upward. At the same time, you can even tilt your head slightly. And I'll ask you to close your eyes, and you might notice that on one side, the corner of your mouth lifts easily, while on the other side, it's harder to lift. Why is that? That's actually due to tension. Try to feel where this tension is coming from. Most often, you'll notice that this tension comes from somewhere in your body. Place your hand on that spot, for example, on your chest and on the corner of your mouth, and stretch as much as you can. You can stay in this stretched state for a while, until those tissues start to relax. Or you can slowly make circular stretching movements like this. Do this for about 2 minutes. Just stretch and make circular motions, and observe what happens. Don't forget to breathe. And after that, you can smile and see how your smile feels. You can then do a retest and see on one side and on the other how the tissues move. And you'll notice that on the side where you did the exercise, the corner of your mouth will lift better. After that, do the same on the other side. Also for about 2 minutes. Grab the corner of your mouth. Place your hand on your chest, on your sternum. Create some tension and make circular movements like this. At first, you might feel some tension, like something is being pulled. If you keep your focus and your hands on that tension, making those circular movements, you'll notice that the tightness gradually relaxes, and eventually, the tension might even go away completely. And after that, the corner of your mouth will start to lift. And along with the corners, all these structures will start to relax and lift as well. Also, one of the simple and effective exercises is to make a figure 8, like this. A circular movement to form the figure 8. When you move your mouth, thanks to the movement, you're giving yourself a massage. These muscles relax. The muscles that relax first are the ones responsible for facial tension, for the tightness. I recommend regularly doing lymphatic drainage. Your movements should go from your chin to your ears. I recommend doing this all the time. You can even do it like this. So, for example, if you're in front of a mirror, you can use your hands to smooth out like this, in one direction. This is really the bare minimum to relax this area and get rid of stagnation. And remember, a sagging face and deformation are not a sentence. And it doesn't mean that you need to run to plastic surgeon right away. Subscribe to my channel. This was Dr. Alice with you. See you next time.